My name's Francesca Carr. I'm the lead physiotherapist for the women's team. We do blood tests quite regularly, especially if we think that there's anything sort of untoward or we're concerned about anything, not just medically, but post-injury, and also as part of just baseline testing. So a lot of the stuff we kind of look at is towards vitamin D and iron, things like that we know we can help supplement food first and then with supplementation. And working sort of professional football on both men and the women's side, you're looking for the little gains, you're looking for the 1%ers. So if you are not recovering well, not sleeping well, because for example, your B12 is low, then if we can help that, that's only going to help them all on the pitch. Vitamin D is a big one, I think, currently all over the place, but especially in sort of the Northern Hemisphere. So I've worked across different sports, a lot more where you do get more Southern Hemisphere players. They come up to the Northern Hemisphere, don't have the sunlight, don't have the vitamin D and that sort of natural input. So we know that that's massive on recovery, bone health, muscle health, brain health, lots and lots of different things. So that is one of the main indicators, especially in the women we're looking for at the minute. With women as well, you've obviously got a lot to do with the menstrual cycle. So we are trying to get the girls to track not only their sort of results from blood tests and on-field tests, but also with regard to their menstrual cycle. And if we can help, supplement that kind of things in any way, if any of the girls show up with anemic, it's obviously going to affect their on-field performance. So we try and make sure that we're covering all bases with them, especially from a female health point of view. Yeah, so we baseline test, especially if we are having a player new into the club. So we will then make either a supplementation, food, a plan to try and up those results that we're concerned about. Sometimes it's every 6 weeks, depending on what the issue is, but we'll tend to baseline everybody once or twice a year minimum, usually again seasonal, so coming back out of the winter. So we'd be due to test our girls quite soon, going into spring, just to see if there's anything that's changed over the last couple of months, if everything we've put in place has been heading in the right direction or whether it's been heading in the wrong direction. Yeah, CRP inflammatory markers, especially during recovery periods, especially with players that have tendon issues, but also just general inflammatory markers. The guys are fed really well and looked after really well from a dietary point of view to try and reduce that as much as possible. But it is kind of, if we're looking, especially someone that's repetitively getting injured, the same type of injuries, the same type of tissues that are damaged, then CRP is huge. The other things in there that we will look for are different things in the creatine levels and things like that, but usually our sports scientists deal more with that than me. So I just get sort of the baseline information.